Brought the pandemic we never thought we would experience, and as we step into 2021, there's hope that we're nearing the end. But there's another crisis that's grown worse in the shadows of COVID, and Kentucky's Drug Enforcement Agency is trying to stop it.
He's the special agent in charge of what he calls the drug version of the FBI.
My guys will work these cases 24/7.
Todd Scott took the lead at the DEA's Louisville Field Division right as the pandemic hit, covering Kentucky, Tennessee, and West Virginia. While COVID kept most of us at home, Scott says it did just the opposite for the criminals he's chased the last 26 years.
We have some significant drug trafficking organizations throughout Kentucky.
Meth, heroin, and fentanyl.
Fentanyl is a extremely potent and deadly opioid. 3-4 years ago, we might see small bits of it here and there, kind of mixed in with heroin and things like that. Now we're seeing pure fentanyl out on the streets.
Produced and shipped by the Mexican drug cartels.
The fact is there was still a market for that. And just socially, when you see people who are isolated, you see people who are alone, you see people who are losing their jobs, stresses that drove people to these sorts of substances before were still here. None of that had gone away, and in fact had been exacerbated by the pandemic,
leading to record numbers of overdoses nationwide and here at home.
Predominantly opioid overdoses and specifically fentanyl.
A deadly trend overshadowed by the current pandemic. Last year, a record 81,000 overdose deaths were reported within a 12-month span across the U.S. That's a 38% increase from the year before. Metro Louisville saw more than 600 overdose deaths in 2020, up 62% in a year's time.
Historically, for DEA, for a lot of law enforcement, these overdose cases were treated as accidents or tragedies. We're now starting to treat these as crimes, because we've noticed that a lot of times if you have a significant number of overdoses in a small area, that it can be attributed to one person, and that person's a drug trafficker. And so we can go after that source.
Today, if the DEA can prove you're a source for a particular overdose, you can get a 20-year federal prison sentence on top of the time you'd already spent as a drug trafficker.
You had a period of time for a few days where you had numerous overdoses. After we got this individual off the street, those overdoses all went away. So you can see a direct result of our work, and we're keeping people safe.
In Louisville, Brooke Hash, WHAS 11 News.